The world might have caught a break with H1N1 because it was very easily passed and very easily caught, but not very lethal. But it did illustrate something about how germs spread in the 21st century.
Well, first of all, I think it proves that germs spread, one, very easily, two, they do not recognize geopolitical borders. So they will easily move across country borders. They'll move from one community to another. The way that we interact as a society today makes it incredibly simple for a virus, or a community of viruses essentially, to survive and thrive in the multiple interactions that we have with one another.
When I was a reporter in Chicago, I covered a measles outbreak in a largely immigrant Spanish-speaking community. And the doctors in the neighborhood were just banging their heads against the wall because it was so difficult to get the word out that there was a really big problem in this geographical area. Please bring your kids in for a vaccination. What's different about practicing community health medicine, infectious disease prevention in these kinds of communities?
The problems are multiple. The first problem is making sure, as you pointed out, that people actually hear the message. So you have to be sure that the folks that are living in these communities that may be undocumented are even aware that there's a problem. But once they're aware that there's a problem, are they willing to access the systems of care? Are they willing to go through a process of surveillance? Are they willing to come forward if there's a vaccination? Perhaps if there's a vaccination, somebody might say, you simply need to prove your eligibility for the vaccine. You have to prove your age, for example. And then once again, they're forced to produce some document, some identification, and at that point, it becomes a barrier. So there are multiple barriers. One, of hearing the message. Two, of trusting the message. And then three, of engaging in the systems that are out there, public health and otherwise, and medical.
So trusting the messenger, too.
Indeed.
So can you craft a message, Jenny Rejeske, that people will say, okay, this is a low-risk proposition for me? And what do you have to keep in mind when you do that?
I think it has to come from, I think the most important thing is it has to come from someone who's trusted in the community, someone who speaks the community's language and understands their culture. It's those types of messages are most effective coming from community-based organizations, coming from clinics in the community, coming from trusted sources in the community. And once community members know that there is this trusted source, know that it's safe to go to a certain healthcare center or safe to go to a hospital, and they're going to be treated well, and they're not going to be asked about their immigration status, or that information is going to be shared, then they will respond to the message.
But haven't some of the ways these programs have been funded required that you ask? In our current political atmosphere, aren't providers that use various levels of government funding told, well, yeah, you've got to ask whether people are here illegally? Yes, lower those barriers, but at the same time, people who want to provide services are finding the barriers have to remain there. James?
Yeah, one of the best kept secrets in American healthcare is the community health system. I'm always surprised, because I've been in it for 20 years, that when I tell people what I do, they look at me quizzically, wondering what that's about. But community health centers have been here. Actually, the first community health centers were migrant health oriented back in the early 1960s. And then the community health movement really started in 1964. So that's been a long time. And the point of community health centers is to care for everyone, as Dr. Abramson said. Everyone should be cared for, and to not have, to minimize the barriers so that cost is not a barrier, legal status is not a barrier. And we've had to fight for that over the years. Since the 90s, I would say, welfare reform. There was a big push in Congress to require us to document those we serve. We fought it then, and we continue to fight it now. And the next step is going to be what happens when health care reform is enacted completely. whether that requirement will be there. But as of now, people can go into community health centers with complete trust that they are not going to be asked questions about their legal status.
Does it complicate things when you take a government dollar as opposed to a charitable or not-for-profit dollar as far as the provision of care and the trail of documents that has to be produced?
Oh, definitely it complicates things. We have to look at it not just from where we're coming from, offering these services or access to the community, but also we have to understand how the community perceives the situation, not just based upon their preconceptions, but also what's happened in the past. They know very well that if they get registered, their information gets obtained, somehow that gets gathered, and then that's used for some type of purpose, and their concern is obviously that they will be caught and deported. That's their main concern. So there's no level of trust there, but there cannot be a level of trust because they're not part of the system. It's not just the literacy barriers and cultural barriers, but it's also the fact that they don't trust the system because the system really doesn't serve them. Also, we have to keep in mind that when we're all talking about the public health system, the American health system, we're all assuming that it's really doing a very good job and that maybe the immigrants or the undocumented are really a problem because they're just not accessing a highly efficient system. But the system is really not efficient at all, and this is well documented, and that we have a healthcare delivery system that is actually ranked 48th in the world, and we're behind Japan in regards to life expectancy. And from a public health perspective, this generation of young Americans, documented young Americans, is the first generation that is going to live less than the previous. And so all of this gets amplified in these minority or undocumented communities.